Hi there, my name is Teresa Harzo. I am a DBS nurse here at Providence St. Vincent. I work very closely with Dr. Seth Oliveira, the functional neurosurgeon who does the implants for the DBS system. Most likely I have talked with you up until now, and it's really nice to meet you. I wanted to go ahead and share with you some additional important things for you to know just prior to your surgery. Please know that this presentation may drum up some questions or concerns. Please don't worry. Give me a call anytime. I'm always available to help you. All right, let's get started. Wonderful. So, things you need to know before surgery. Well, Dr. Oliveira has a specific type of MRI he will want to have done with your brain. The importance of this MRI is imperative. He needs to be able to map out the trajectory, where he's located, starting from the exterior of your scalp to the interior of the nucleus of their target site, just special for him to help with your abnormal movements. So contacting just any MRI department won't work. He will ask you to go to a specific location. The Oregon Clinic will help you with this. When it comes to scheduling an MRI, if you live locally, it's not uncommon for people to get them done ahead of time. However, if you are coming from out of town, it's perfectly reasonable for you to have your MRI scheduled the day before surgery. Coming to town a day before reduces your stress. You coordinate and schedule a place to stay, such as maybe our guest housing across the street. Phone number is located on this screen for you. And then you go get your MRI the day before, stay the night, short 30-second drive across the street, and then you arrive for surgery. So it's something to consider. Now, the one thing we definitely need to have you do during the pandemic that we are in is have a COVID test done within 5 days of the date of your surgery. The Oregon Clinic will supply you with a phone number to contact if nobody has contacted you before maybe 10 days before surgery to help arrange your COVID testing. These COVID testings do not have to be done in the Portland vicinity. Coordination with those results to be sent to St. Vincent are done quite easily. To help reduce any stress and anxiety, since having brain surgery doesn't do enough, then we want to make it a little easier. Making sure you know where the St. Vincent is, where the check-in is for surgery, where to park your car, all of these things. So do know if you are traveling from Eastern Oregon, let's say, and you're coming in off I-84, you're going to want to get on I-26 headed eastbound before you can make your exit off 69B. If you're coming from down south in Oregon, then you're going to come up I-5 heading north. Then you're going to take I-217 north. These next couple pages have maps on them to help make it a little easier for you. This one shows you the freeways that come together. Where you're going is onto Southwest Barnes Road. As you see, there's a couple different parking lots, west parking and east parking, and there's also valet parking. If you look at this screen, the West Pavilion entrance down on the bottom right, that is also showing you that location so you can identify it when you're there. Valet parking is available. The main entrance gets you closer to where you check in for surgery. As you can see, I've highlighted these places. Now, the one thing is DBS is really, really popular for those with Parkinson's. So if you have Parkinson's, please hear this. If you talked with Dr. Oliveira about having awake testing, meaning the anesthesiologist is going to gently wake you up out of anesthesia, so Dr. Oliveira can ask you to do some certain commands, whether it be, moving your hand one way or responding in another. Not that you're going to remember it that well. It's never really any kind of worry. It's just a matter of whether or not you've agreed to do it. If you have agreed to do it, please do not take your Parkinson's medications within 12 hours of surgery. This way, when he's fine-tuning the exact quarter of a millimeter location of that wire in your brain, you'll be able to do it without anything blocking your movements, such as the medication. If you have Parkinson's and you take a medication called Rytary, which is a very popular medication, I'm afraid to tell you we do not stock it at our hospital. This medication is a specialty medication, as you know, so please bring it with you to the hospital and give it to the nurse that helps prepare you for surgery. She will, or he will have it sent to the inpatient pharmacy to tag it, and then while it's being tagged, and it'll be sent back to the recovery room, available for you if you wake up after anesthesia in the recovery room, regardless if you take Rytary or Sinemet or another Parkinson's medication, and you feel that your symptoms are worsening. If you are able to ask for your Parkinson's medication and the nurse sees that you are safe to swallow, they will give you your medication. That way you don't have to wait till you get transferred to the floor. Now, eating and drinking prior to surgery, this information's probably already been supplied to you by the Oregon Clinic. This is a friendly reminder. Please do not eat or drink anything except for water after 10 p.m. the night before your surgery. But if your surgery is, say, 5:30 in the morning check-in, you can drink water up till 5 a.m. Otherwise, don't drink any water up to 2 hours before arrival. The screen shows here, this includes no gum, no candy, and no mints. So I want you to prepare for your best recovery. That includes having your home ready. Before you go to surgery, please check your home for any loose rugs or cords or anything that you could trip on. Coming home to recover, you might need to be, walking slower or shuffling your feet, and I just don't want anything in the way to cause you to trip up, have a fall, and then actually cause an injury. So also another wonderful thing that was brought to my attention a couple of years ago is that when you have this little teeny battery that's implanted underneath the skin below your collarbone, it can feel like it weighs a ton. Of course, you just got out of surgery. While it doesn't weigh a ton, but the tissue on your chest, whether it's breast tissue or regular chest tissue, it can kind of pull on it a little bit, making it feel like you're really shifting it one way or another. So maybe wearing a wide strap sports bra or something firm, some kind of form-fitting clothing to help kind of hold your muscle and your mass, your tissue mass in place, so you don't have that discomfort. Lastly, please limit all your visitors. Your brain is going to be tired and you probably want to take frequent naps. Just a thought. Let's talk about your hospital stay. Generally, 8-9 people out of 10 are going to go home around lunchtime the following day after surgery. Things that can keep you from going home that soon is probably one, your surgery was later in the day and you haven't been observed for a 24-hour period, so they keep you a little longer. Might end up having to stay an additional night if you're having issues emptying your bladder, pain control, which is not very common, imbalance that's a little bit more than we would like to send you home with, and you might go home with a walker just to keep you safe until your balance gets back to baseline, or other unforeseen reasons. The goal is for you to get the most out of your recovery in the comfort of your own home. So let's talk about post-surgery side effects. Now, these are very important. These are things for you to be aware of. And then if they happen, oh, Teresa reviewed these with us. Not to be alarmed, but to watch and keep an eye on it. These things are known to be temporary and to resolve in a matter of days, if not maybe 10 to 14 days. Temporary tingling of your face, arms, and hands and legs. Temporary. Should continue to improve on a daily basis. Slow or slurred speech, well, that's almost a given. I'm always surprised when somebody doesn't have it. However, it happens frequently. So if you are speaking slow or have slurred speech or slow thinking and trouble with concentration, I'm never surprised. Again, I never have a concern as long as it continues to improve day by day. Blurred vision or double vision, I see more or hear more about blurred vision than I do double vision. So not counting that you wear contacts or glasses, we're talking about baseline prior to surgery. How's your vision? If it's not as good as it was before surgery, just watch. It'll continue to improve. Dizziness and loss of balance and possibly reduced coordination is extremely common. And this takes me back to our previous slide. Making sure that you are staying upright on your feet or in a safe place, such as a wheelchair or with a walker, and not any worse than, because falling is not an option. Loss of balance from lightheadedness is very common, and I don't want you to have a fall. So please be careful. Use the tools that you have to stay safe. Not everyone's going to have any of these or all of these side effects. Some people have none, including headaches. If you have a headache, Tylenol will help. Incisional wounds. Well, you could end up with one incision on top of the head, two incisions, or maybe one big one. It just depends on the approach that Dr. Oliveira needs to take to reach the target site in your brain. You'll have another, about a 2-inch wound or incision back behind the right ear. Unless you've had a conversation with him. In regards to rifle hunters, they like to put the butt of the gun in the right armpit, hence the incision will go on the left side. Typically, he will always go to the right, the gun butt will go to the left side, and typically we go to the right side. Sorry about that. The reason for having the wires and the battery on the right side is because if you need a cardiac pacemaker at any given time, or if you come to us with a cardiac pacemaker, it's probably on the left side. So we reserve it for that. The final incision is going to be right below your collarbone, about 2 finger widths. And then all of these are probably going to be closed with dissolvable sutures underneath the top layer of skin. And if you don't have staples or sutures, he's going to use a Dermabond glue. It's a special super glue made for skin. Note, don't pick the glue off, please. The glue will eventually start lifting off the skin. It has been applied in the OR during a very sterile procedure. It is now your bandage. All right. So going back to not picking, please don't ever pick your wounds. I want you to take a shower every day if that feels good, but don't wash your hair for at least 2 days. Use your normal shampoo, your normal bathing products. It's all perfectly fine. Use the soft pads of your fingers. Do not use the tips. We want to make sure that you are gentle when you're cleaning. Please avoid gardening. I know how hard that is to hear. Gardening is a wonderful pastime for many of us. However, dirt does carry a lot of bacteria, and I don't want the dirt to get near your incisions. Dirt can cause infections. Avoid any and all ointments, Neosporin, any type of triple antibiotic creams or anything to your incisions unless instructed by Dr. Oliveira and his team. Activity restrictions, not a whole lot. Walking is best. We don't want you to do anything strenuous. I'd like you to avoid putting your head below your heart. If you're doing dishes, bending over, getting into the dishwasher, cooking, getting something out of a lower cabinet, those kinds of things, and getting laundry out of the dryer can all cause sudden onset of dizziness. I don't want you to get dizzy. I want you to be safe. I want you to stand up and be able to avoid any onset of falls. So, last thing, everybody wants to get back in the car and drive. Now, if you were a driver before DBS, we'll get you driving again. However, please do not just go out and drive, especially if you're taking any narcotics prescribed for pain after surgery. If it's been a week or 2 weeks, you feel like you're back to your old self and baseline, well, take caution. If you get in the car, be in the car with somebody you trust who's going to give you real honest feedback. Go somewhere safe to drive. Make sure that when you are driving, that you have full range of motion of your neck and full response back to your normal. So then that way you can respond to any unforeseen situation. Which takes me to talking about your neck. The wires from your DBS, from the brain, travel down behind one ear and down the side of the neck underneath the skin to the battery. So your neck might be a little sore. And because it is sore, I doubt you're really going to move it a whole lot for the first week. But after a week, when that pain or discomfort starts to go away, I want you to purposefully start turning your chin to your left shoulder and your right shoulder. Look up at the stars and down at your toes. It's so important to do these moves frequently throughout each day. Maybe every time a commercial comes on TV or you're turning a page to a book or magazine. This way, you keep the flexibility and the full range of motion in your neck that you had before DBS for continuing thereafter. At about 4 to 6 weeks after surgery, your body will have created a scar tissue underneath your skin adhering to those extension wires down the neck. If you do not practice regular movement of your neck, that scar tissue will actually tether your neck and the extension wires down into a tighter position, limiting your range of motion. You can prevent this. Make sure you move your neck, again, full range of motion, even before you drive. So surgery's done, you go about your life, you find out you got knee pain or shoulder pain or something's going on, and a doctor wants you to get an MRI for them to further diagnose what's going on. Please make sure you contact your neurologist's office first. While most all and DBS systems are MRI compatible, there are conditions. There's conditions of making sure you have no open or short circuits. So contacting your neurologist's office is the very first thing that you need to do. Maybe the doctor that you're talking with wants you to get an EEG or an EKG, echocardiogram. In a case like this, it's okay to get those, but we want you to turn your DBS system off before these tests are performed. DBS can cause false readings on those tests, and your provider is going to want to be able to read those tests correctly, so that way they can give you the proper diagnosis and treatment for whatever you had to have them for. Well, who doesn't want to take a plane and fly, right? After surgery, after 4 weeks is what we recommend. Please do not fly within 4 weeks after you have your DBS implant. The brain needs time to heal, and flying at that altitude can cause extra pressure within your head. Also, when you do start flying and you have to go through the TSA portal, it's really important that you walk through the middle of that portal or stand in the middle and not lean to any one side. They have magnets in them that can cause your DBS system to turn off. Which brings to mind, if a TSA agent pulls you aside wanting to hand wand around you, please let them know that you either have a DBS implant or say, I have a cardiac pacemaker and this is my battery. Please do not hover over it. In the interim, though, always carry your DBS identification card with you, which you will get after surgery from the DBS representative, along with the handheld remote that you will be given. You will be shown how to do that, use that by your neurologist on how to turn yourself back on, just in case the TSA agent turns your DBS off. Everybody needs a post-op appointment. This is very important. Having a 2-week appointment with Dr. Oliveira's physician assistant will be set up for you. For those of you who live close by, that's not a problem. However, if you're living out of town, more than an hour or so drive, obviously we don't expect you to drive up for it, but we do offer you an opportunity to make arrangements to either go to urgent care or to your primary care physician for a wound check. If there's staples or sutures, they will need to remove those. If there's any kind of incision concerns, communicating with the Oregon Clinic is key. So the 6-week appointment, what do? Dr. Oliveira wants to see you. Again, maybe you live out of town. Then all you have to do is contact the Oregon Clinic, let them know whether you want to come in for the appointment, or if you would like Dr. Oliveira to call you for your 6-week appointment. Works just fine. Please make sure you let the Oregon Clinic know what your preferences are for these 2 appointments. So you find out you're having DBS surgery. You need to call your neurologist's office. Make sure they're aware of the day of your surgery so they can start scheduling your programming appointments. The most important part after surgery is getting it programmed. Here at Providence, we do schedule those appointments typically around 4 to 6 weeks after surgery. Your neurologist might choose to do it at 2 or 3 weeks. So giving them a heads up as early as you can is best. If you are a Providence patient, and you have Parkinson's, we do ask that you stop all of your Parkinson's levodopa medication or Rytary 12 hours prior to your programming visit, the first initial visit. So that way you come in off your medication. The neurologist will be able to program you in an off state rather than you on your medications. It's no benefit to them or yourself to be on your medications. But before I go on, bring your medication with you to the appointment because you'll probably want to take it when they're done. This slide talks about Dr. Oliveira's research project. I may have mentioned it to you. You may have gotten some information on it in your packet from the Oregon Clinic. Throughout 5 years, periodically, I will either reach out and call you or send you a letter asking for a little feedback on how DBS is doing for you. It could be a positive thing you share with us, and it could be something not so positive. We do need to know. It is important to us so that we can continue to provide the best service and outcomes for our patients and make any changes that we need to do. Without your input, we are not going to be able to provide better service without knowing how it came for you. None of the personal information that you have, any of your medical record numbers, your date of birth, your social security, nothing will ever be shared in this process. Hopefully, at some point in time, Dr. Oliveira will wish to publish this findings and share them with other people in the industry. Again, no personal identification will ever be shared, just your reported outcomes. So if you have any questions about any of this information that I just shared with you, it is imperative that you please do contact me. I'm happy to answer any questions you have. You can contact the Oregon Clinic as well. My information to call me through Dr. O'Leary's office, Dr. Anderson's office is right here on this screen. You can send me emails. If you see a neurologist outside of Providence, the number is listed here for that also. So what I am saying is I do not want you to hesitate at all to reach out to me so that I can help you have the best experience possible with your DBS system. I hope you have a wonderful surgery and heal really well and really fast and have a great outcome from getting it. I look forward to talking with you again. I hope you have a wonderful day. Thank you.